Thanks, Tom.
Thank you very much indeed, Nick. I think you've just proven how incredibly complicated this field is. I don't think I've ever heard quite so much information or questions in a 10-minute slot. Very, very interesting. And thankfully, we have someone who might be able to answer some of those. There are a few people that know more about these big global funds than Richard Manning, who was the vice chair of the 2010 replenishment of a global fund and is currently working for the Gavi for the pledging conference. Also chair of the DAC, long-time experience within DFID. I don't think you've worked on climate funds or this kind of area before, so what we're kind of asking from you is a view from experience on other kind of funds. How do you respond to some of those thoughts that Nick put down?
Well, thank you very much. I'm going to try and do two things in my 10 minutes. One is to tell you a bit about a round table we ran on this subject at the Accra High Level Forum, which I think touched on some of the key issues in this debate, and then to pick 6 lessons I've kind of picked up from the work I've done for the Global Fund and Gavi over the last 18 months. So at the Accra High Level Forum Aid Effectiveness in 2008, there were a series of round tables on different subjects, and I was involved in one which took 2 things. First of all, the so-called new donors agenda, China, Gates and all that, and secondly, what were called global program funds was the thing we came up with. And this round table was prepared by particularly a World Bank report in which Paul Eisenman was heavily involved, which looked at the experience of global program funds like the Global Fund, like the GEF, like Gavi and so on, in a range of countries. Showed on the whole that these things worked pretty well in middle-income countries, but were more problematic in the more aid-dependent countries. That then led to a session which was addressed by the Rwandan finance minister, Michel Kazachkin of the Global Fund, Gunilla Carlsson, the Swedish aid minister, and Ms. Alamani, who was representing an NGO, the Association of Women's Rights. And just to say very quickly how they conceptualized this, the Rwandan finance minister said there were important successes by the global funds in his country. I think he thought particularly of health, but also an imbalance between diseases. And Rwanda's been the kind of poster child of very heavy spending on HIV/AIDS when there are a lot of other health problems in the country. Michel Kazachkin referred to the way the Global Fund was now getting more involved in national strategy applications, so looking more broadly than a very narrow disease focus on health services strengthening. Argued that we shouldn't take a simplistic view at between vertical and horizontal approaches, and argued that sustainability was an important issue but could only be achieved over a long period. Minister Carlson was in an interesting position because she was already getting involved with the climate change financing debate at that time. She was playing a leading role in that. She picked up Paul Eisenman's well understood slogan about think twice before inventing new vertical approaches, which was integrated into the thinking of this thing, that it was better to reform existing agencies than create new aid channels, and that we should learn lessons specifically from the financing of HIV/AIDS for climate change finance. She didn't go into a great deal of detail as what those lessons should be, but I think her general trend of thought was clear. Ms. Alimani was wanting better alignment of these global programs, have more of them on budget without squeezing the civil society dimension. Pointing out that global program funding was not necessarily additional to other things, of course an issue for climate change as it has been for health, and wanting more UN involvement at all levels. We had a number of conclusions, and I put these on slides, and I'm very happy to email these to anybody who wants to have them emailed in some detail. And I'm not going to go through all this in detail, but we addressed ourselves to various people. To the donor side, you'll see the things on screen, particularly the Think Twice policy. And I think also, I'd stress the third one, more consistency in the way donors operate in the boards of the various institutions, which we thought was a significant weakness in the way things worked. Just saying, no, that works brilliantly, but how do you do it? So press the wrong button. Try that one. That the boards of these institutions should really take the Paris Declaration seriously, and a battery of things, but I'll pick out here particularly actively engaging in learning processes to improve effectiveness. One of the quite interesting developments was the Global Programs Learning Group, which was put together by the Global Fund with Gavi, the GEF, I think one of the urban funds and so on, to look at how you could align practice more in accordance with aid effectiveness principles, despite the way that the funds have been set up, looking at relatively narrow dimensions of development. A key question is obviously how the recipient countries, the implementing countries, operate. And I think key to this is good coordination between the sector and central ministries. I mean, one of the basic dilemmas, certainly in health, it may be less so if climate change is more of a trans-sectoral subject, as Nick puts it, is that, of course, health ministers like health funds of all sorts because they don't have to go on their knees to finance ministers to get funded. So any sectoral ministry basically likes an international themed sectoral fund. Finance ministries equally hate them. And there is, of course, a very interesting dynamic around that, which needs to work well at country level if we're going to make progress. And you'll notice also the last one, that global program funds have provided for greater engagement with non-state actors, picks up one of Nick's points. And that's particularly written into the genes of the Global Fund. And then some indications for the NGOs themselves, coordination with governments, transparent reporting, DAC improving the reporting on the flow of funds, which, to be fair to the DAC, I think they've done quite a good job on, and continuing to encourage active learning and so on. And in general, everybody to push for a more evidence-based discussion of what was sometimes a bit of a sterile horizontal versus vertical debate, and to consider, as it says, this is really the question we're trying to answer here, do we do best to broaden the mandate of global program funds, make them somewhat less vertical than they were originally set up to be, or do we adjust the balance between vertical type initiatives and broader based programs? And this relates in health in particular, how do you fund health systems? Is it best to, for people like the Global Fund, to finance a bigger slug of health sector spending, or is it better to rely on institutions like the World Bank or others to do the sector stuff? And that's a debate that continues, obviously. Now, let me just finish with some things that I think the lessons that I've pointed out from Accra are still pretty relevant. I mean, I think the analysis still has a lot of resonance, even after 2.5 years. But I've certainly had a learning experience since then in attending Global Fund board meetings, in working for both Global Fund and Gavi with a range of donors and seeing how donors are reacting to these funds. And the 6 points I'd just like to draw to your attention arising out of these. The first is that these global program funds are extremely good at one thing, which is this kind of upstream pooling effect. If you look at what's happened in relation to vaccination coverage, the fact that pneumococcal vaccines are now available already in places like Kenya and Nicaragua, whereas it would have probably taken a decade pre-Gavi to achieve that. The fact that insecticide-treated bed nets in Africa have become very high proportion of the infant population from nowhere 5 years ago. And you ask yourself, how would this have worked with a British program for this and a Belgian program for that and an Italian program for something else? And you compare that with the virtues of pooling this money upstream for relatively simple interventions. These are simple interventions. Nobody's, it's not highly complicated delivering vaccines. And they're scalable. They can be done on a big scale. You can develop market power, particularly in Gavi's case, because Gavi actually buys the vaccines. It's less so for the Global Fund, because the Global Fund finances countries to acquire drugs, and they can do it by a voluntary pooling policy, but they don't have to do that. And this, I think, is a big, if you look at it in terms of Paris Declaration and Accra and so on, it's a big way of rationalizing and delivering stuff and changing conditions on the ground incredibly quickly compared to other ways of doing it. So that, I think, is a very important lesson. Whether it can be applied quite so readily to some aspects of climate change, which inherently I think is more complex, is a big question. So that is well worth thinking about, I think, in how you design the climate change side. The second thing is that any global program fund, whether climate, health, or anything else, is going to have objectives. Anytime donors nominate their own objectives, there is necessarily an issue around whether that squares with local priorities or how far it squares with local priorities. And of course, people have different priorities. I say health ministries like a lot of this stuff, although they may think there's too much of it for HIV/AIDS and not enough of it for something else. Finance ministers may say, why should our health sector get so much attention when our roads are crumbling? And we have to recognize that anything we put together internationally, or indeed bilaterally, which has particular objectives, you always have to then mediate that with what are the local priorities. And after all, over there, presidents, prime ministers, and finance ministers are trying to run countries which need everything. They're short of everything, and they've got to try and rationalize this flow of funds in a way that makes sense to them. As the World Bank study showed, relatively easy in middle-income countries, much harder if aid is accounting for 40% of your budget. So that's always a big issue, and fungibility comes into this. Very interesting study by the Institute of Health Metrics last year, which showed that in Africa, those countries that were the largest recipients of global fund money were tending to spend less of their taxpayers' dollars on health, not much, but a bit less than those countries that were getting less. So there's some aiming off, but as people have said before, fungibility is always more than donors would like and less than recipients would like. Narrow or broad, the issue I've already put on the table. Is it right to should Gavi, as Bill Gates I think would argue, stick very much to vaccines and do almost nothing except vaccines, or should it, as probably Diffid would argue, have a somewhat broader remit, at least into vaccine-related aspects of health system strengthening? Again, with climate change, that's going to be an issue you need to think about. I think it's worth thinking a bit about the benefits and risks of what you might call the financing institution model. Both Gavi and the Global Fund were set up on the kind of American foundation principle. Let's have a very small secretariat. Let's have a technical committee that vets proposals. Let's agree them according to some transparent criteria. We invite proposals, deal with them, finance them. We won't have any presence in country. People can get on and do it. And there are some benefits to this. It means that you tend to use local systems. It means that local decision making is arguably very important. But as the Global Fund has discovered to its cost recently, if things go wrong on the ground, you can easily be held in a very difficult situation that you're not controlling your funds adequately. So it's not different from the risk one runs with general budget support or anything else that goes through local systems, but the lack of a country presence and this kind of let's have a small secretariat model is clearly under strain. The Global Fund is now, I think, has a staff complement of about 600, so it's not 25 people. I think people had unrealistic expectations at the start of some of this, what a financing institution would be. On the other hand, let's take IFAD, another kind of global vertical fund that's been going for a long time. It does have moved to country representation, but its operating costs are virtually a quarter of its actual spend, whereas in the Global Fund, the relevant statistic is 6%. So one has some interesting choices there which need to be thought about. Sustainability. Again, I think people had, in some cases, unrealistic expectations about how fast people would take things up, e.g. in vaccines. China has taken over the vaccine program in China, that's entirely right, but it's hard to see how Mali and Malawi are going to finance the higher cost of pneumococcal vaccines anytime soon. They're making a modest contribution, they have to do it under Gavi rules, but it's going to be a very long time for all activities that finance recurrent costs to become fully sustainable, and we have to think decades here rather than years for the poorer countries. Of course, climate change will be looking at capital as well as recurrent transfers, so the situation may be somewhat different. And finally, governance. I've certainly learned some lessons in the Global Fund Board about the complications and interest of managing a board which is not just about the usual northern and southern governments. The fact you've got a seat for the private sector, the fact you've got a seat for foundations, the fact you've got a seat for northern and southern civil society, the fact you've got a seat for people affected by the diseases, changes the dynamic of the institution in quite a lot of ways. My first thought when I attended my first fund board meeting was this was a ghastly system and that the conversations around the table were extremely tedious and unlikely to go anywhere. But I revised my opinion of this quite quickly, and I think the Global Fund is actually an extremely interesting governance model that people should look at more carefully as a way of brokering complex deals among a wide range of stakeholders who over the years have actually acquired a good understanding of each other's red lines and a good deal of respect for each other. Whether it's government of civil society or civil society of government or whatever. And I think it's a really interesting model for which there are significant lessons which might be learnt also by climate change funders. It's not straightforward. I'm not sure that I'd recommend any particular approach to this, but I do think these multidimensional boards are something the world's going to have to think about rather more. Thank you.
Well, thanks very much, Richard. What a fascinating overview of some of your lessons from global funds. Last one I found especially interesting. I was over in Copenhagen for the evaluation of the Paris Agenda last week, and interestingly, one of the indicators in the Paris Agenda is a reduction of parallel implementation units, but it seems that some of the